Well, it's certainly been a long and tortured battle for Obamacare, and it seems as though the president's legacy legislation will yet face more obstacles, with Republicans holding now control of not just the House, but the Senate, as we know, after Tuesday. Wall Street Journal ABC News poll taken in September shows that 34% of Americans approve of Obamacare, while 48% disapprove of the legislation. Some other polls have this as closer, but still, America is still conflicted on this piece of legislation, and I would argue many still confused, not knowing all the elements of it. Let's bring in Aaron Smith, co-founder of Young Invincibles and president of the Young Invincible Advisors. He joins our panel now with more on not just Obamacare and the long road ahead, but also the not too distant future. The high courts decided to take a look at this. Explain for our audience here what they're looking at and what it could potentially impact. It's not the same for every state.
Yeah, absolutely. So the Supreme Court decided to take a case where they're going to look at the subsidies available to consumers in the federal exchange states. So as you might know, some states decided to do their own exchange, like in New York, California, Connecticut, but about 2/3 of states decided to let the federal government run their exchange. So Florida, Texas, big states like that. Many that were opposed to the health care law. So what the Supreme Court is going to look at is there's some debate about whether those subsidies that consumers in New York get should also be available to those federal exchange states, so places like Florida and Texas that I mentioned. So that's really the debate. I think the overwhelming feeling among legal scholars is that the intent of the law was that everyone should get access to those subsidies. We know, so there were a little less than 8 million people who got health insurance through the marketplaces in the first year. About 80% got subsidies. So it's a big deal. Now the good news is for New Yorkers is anyway, it's not going to impact New York, California, like I mentioned, but there are a lot of people who live in those other states who could be impacted.
Let me do this chronologically. I argued that for Democrats leading up to the election, that as much as they'd love to treat the president and his policies as toxic, they were still going to get labeled with them. They made no effort to rally around the Affordable Care Act. As confusing as it is, as tortured the rollout, the bad website, all the rest, they were still going to be saddled with it. If they asked you for some free advice, would you say there's stuff to actually run on here? The people who finally have it, the 8-10 million who have it for the first time, go talk to them. They're better off with it than without it, and they'll vote that way?
Yeah, absolutely. And I think, you know, there are over 10 million people who've gained health care coverage in that first year. The open enrollment is coming up again, starts November 15th. Millions more are going to get coverage. I think there's a lot of great things that you can run on. We obviously talk about things like staying on your parents' plan up to 26, ending discrimination based on pre-existing condition. There are millions of people who are benefiting.
And it saves American government money. I mean, we're saving, billions and billions of dollars projected here through the first 6 to 10 years, right?
That's one of the most amazing things, is the law seems to be working both from its expanding coverage, but it's also slowing down the growth of healthcare, which is one of the big goals of the law in the first place.
Politically, already, Republicans have said they're going to try and repeal it again. We know the president, unless he, all of a sudden, has collective amnesia, he's never going to sign the thing. So we know this is a political move. But from a practical level, are there changes that should be made to improve the law? And do you think there's enough consensus on what they are that you can actually get bipartisan support to change things to it without hurting it?
I'm pretty skeptical, actually, that the two sides could come together on some sort of logical improvements. I think we know that they're going to try to repeal it again. I think we know it's going to fail, just like it's failed dozens of times before.
Like 52, right?
It's silly at this point, but it's the politics of it. We look at some issues like, for example, access for immigrants to health care coverage as sort of a next big thing that could be looked at. The law excluded a lot of immigrants from getting access to coverage. Some states, like New York, have actually thought about expanding coverage so that more immigrants who right now are uninsured and maybe still have to rely on the emergency room, which we all know is very expensive, and we could maybe bring down costs by bringing them into the system. So there are some improvements like that, but right now we're just focused on, like you said, there are a lot of people out there, millions, who don't understand the law. They don't understand.
Whose fault is that, you think?
I don't think it's anyone's fault. I think it's a process that takes several years. So, for example, if all my life I knew that coverage was just always too expensive for me, I worked a job, it didn't provide any benefits, and that was just the reality. I think it's a hard transition to understand now. Actually, if you make, let's say, $20,000 a year, you could go into the marketplace and buy coverage for $25 a month. That's pretty remarkable savings, and I think it just takes time for people to understand that and to walk through the process. And I think, we saw in Massachusetts, for example, looking at young people, the uninsurance rates for young people went from nearly 1 in 4 to about 8%. So huge drop in uninsurance rates for young people, but it took 3, 4, 5 years.
But I'm just curious, just for my own curiosity here.
Yeah.
You mentioned that if you, hypothetical, if you had a job at $20,000, you could possibly get some insurance that cost you $25 a month. But from your experience, what type of insurance? Would that be real medical insurance?
You'll have
just scrapes the surface.
Yeah, you'll have a range of options, and so everyone's gonna look. The subsidies are mainly available. You have that silver plan. So there's different levels of the coverage. Silver plan is designed to be a pretty decent plan. You're still probably going to have a deductible, but you could choose different plans. Some of them are going to have maybe more expansive benefits. Some of them might have higher deductible, but be a little cheaper on the premium.
But you can get by.
You can definitely get by, exactly.
Aaron, they're telling me I'm out of time, but as we sit here now in November, are you optimistic or are you nervous what the next 6 months could hold here, whether it be through the Supreme Court or through Washington as it relates on something that you've now worked for years? Is this thing going to get rolled back in some way, you think?
I'm actually pretty optimistic, and I think partly we saw in this election, I think folks thought it was going to be this big issue that decided the election. It really wasn't. I think people are coming around, both Democrats and Republicans, to sort of accepting this thing. We just have to do our work to make sure everyone gets signed up.
Aaron, Dominic, gentlemen, thank you very much.
Sir.
I'll wrap things up when I come back, including news making headlines in the Hudson Valley.